Good evening and welcome to our interactive Q&A panel discussion for Life Interrupted. My name is Brittany Thomas and I am the Associate Director of the Network of the National Library of Medicine All of Us Community Engagement Center. We are proud to partner with the American Association on Health and Disability and filmmaker and breast cancer thriver Paula Mozen to offer this event. We hope after this engaging discussion, you will walk away with increased awareness and understanding of the broad impact of breast cancer on communities who are underrepresented in biomedical research, to connect precision medicine and medical research with finding cures and treatment for breast cancer, to increase awareness of health information resources provided by the National Library of Medicine, and learn about the National Institutes of Health All of Us research program. We hope you are ready to join in an engaging discussion with our panelists. Before we begin, I'd like to cover a few housekeeping items. To engage with the panel, please use the chat feature. Throughout the discussion this evening, we will continuously monitor questions and comments from the chat for our panelists to respond to. Our panelists will respond to as many questions as they can during our time together, but we regret not all questions may be answered due to time constraints. Closed captioning and American Sign Language interpretation for today's program are available. Please message us through the chat feature if you need any assistance finding captioning or if you have any other technical issues. At the end of the event, you'll be provided with an online survey. We hope you will take a few moments to share your feedback on the format and platform for this event to help us improve future programs. We will also be recording the panel discussion and posting it on the NNLM's YouTube channel. We will also send out that recording to all event registrants within 1 week. Now, with great pleasure, please allow me to introduce you to Paula Mozen, the moderator for today's discussion. Paula is an award-winning documentary filmmaker, educator, and PBS consultant, and a two-time breast cancer thriver. Paula has served on the film faculties at Towson University in Baltimore, Montana State University, and San Francisco State University. Paula, thank you so much for joining us. I will now pass it over to you.
Thank you, Brittany. It is definitely an honor to be part of this amazing opportunity and to be here today with everyone to exchange experiences, ideas, and information about the breast cancer experience. So I was a documentary filmmaker long before being a breast cancer survivor, and I knew the power of authentic storytelling and how transformative it could be for an audience to experience. When I was first diagnosed, like most survivors, my whole world blew up instantly. I was hit with my own mortality, and I was scared as hell. I experienced the onslaught of new information communicated in confusing scientific terms. I felt I better learn fast and make substantial decisions in a very short period of time that was going to affect the rest of my life, however long that would be. I felt very alone in this experience, even though I knew that 1 in 8 women in the United States will be diagnosed with breast cancer in her lifetime. When it happens to you, it feels scary and alone. When I first began the idea of making a film, I started with the following 2 ideas. One size does not fit all, and breast cancer does not discriminate. However, access to healthcare can and does discriminate in a variety of ways, and we'll be talking about some of those things a little later on. I wanted to make the film I wish I could have seen when I was diagnosed, both times. I wanted to share stories of women who've traveled this road before and include the direct process of diagnosis, treatment, life after treatment, medical information, and psychological impacts. I wanted to do a lot. We are daughters, mothers, sisters, wives, fathers, husbands, and friends. And so many of us know very little about the breast cancer experience. I wanted to help make this journey more transparent and hopefully not as rough for the new survivors to come. As a survivor, I wanted Life Interrupted to be a launching pad for the many diverse issues that breast cancer can and does bring up, to give people the permission to ask questions, seek second opinions, and get support for so many of these intimate topics. So my plan was Life Interrupted could be used to orient people to the authentic experience of breast cancer, including the harsh realities of the treatments shown. I wanted to show people chemotherapy, radiation, and mastectomy. These are all extreme measures that as a survivor, I hope future generations will not have to experience. Current research is working on precision medicine and targeted therapies that can deliver toxins to kill the cancer cells without harming the healthy cells. Additional targeted therapies can help boost your immune system to work better against cancer. So this brings us to the importance of why I'm thrilled to be partnering with NNLM and AAHD to provide awareness of the All of Us research program. This program is committed to building a database of diverse and individual health information that can hopefully impact future decisions in individual healthcare plans by using precision medicine and targeted cancer therapies. Please consider learning more about this program in the link provided in the chat. Okay, so a few takeaways that I hope you got for the film or some food for thought. Number one, to validate survivors' experiences, to give permission to survivors to share their own authentic experiences. You are not alone. Two, to empower patients to be proactive in their treatment decisions, ask questions, get support, make the best decisions for your situation. Three, help providers to treat the patient, not the disease. Survivors, thrivers, we're real people, and we have real nuanced lives. Number four, give family members and friends and advocates a sense of what living with a breast cancer diagnosis is truly like, in hopes that they can give us support in the best way that they can and the best way for us. Number five, Life Interrupted tells the story of how personal and varied breast cancer experiences are. In other words, one size does not fit all. And this is true for every health condition. That is why precision medicine is the key to the future of healthcare. Today's program is produced by NNLM in collaboration with the American Association of Health and Disability. So during our discussion, which is going to happen in a very short while, you will have the opportunity to hear from and ask questions to our distinguished panelists. You'll also be able to share experiences and learn about how research programs like the All of Us research program can accelerate medical breakthroughs for breast cancer by advancing precision medicine. We hope everyone will walk away with a better understanding of how the program can be a catalyst for positive change in research, and why it is important that communities that are underrepresented in biomedical research have an opportunity to contribute and benefit from health studies. Now, let's meet our amazing panelists. Our first panelist is Roberta Carlin. She's the Executive Director of the American Association on Health and Disability and has been in that role since 2002. In 2008, 8 months following a normal mammogram, she was diagnosed with stage 3 breast cancer and underwent numerous surgeries, chemotherapy, and radiation. Ms. Carlin has been the PI on numerous Susan G. Komen contracts, focusing on outreach and education to women with disabilities. She is a member of the Georgetown Breast Cancer Advocates and has served as a consumer reviewer for the Department of Defense Breast Cancer Research Program. Roberta, would you like to tell us a bit about yourself and your experience with breast cancer?
Sure thing, Paula, and thank you. And thanks to all of you for watching the film. Very impactful. I've watched it now 3 times, and each time I learned something new. So thank you for taking the time and having the passion to produce the film. As Paula said, my name is Roberta Carlin, and I'm the Executive Director of the American Association on Health and Disability, which is in Rockville, Maryland, and is a national nonprofit. And our mission is to promote health equity and inclusion for people with disabilities through research, advocacy, and knowledge translation. I was diagnosed, interestingly enough, in 2008 with breast cancer during the same month that our association received a contract from the Susan Komen Foundation. And I can see myself still sitting in my office telling a colleague, as we were planning this and strategizing for this grant, that I had just been diagnosed with breast cancer. And as Paula said, I was diagnosed 8 months after having a mammogram. And I'm one of these really compliant people and had my mammogram every year and ate all the right foods and exercised and did all the right things, whoever knows exactly what that means. So it was kind of a shock to myself and to my family and friends that I would have breast cancer. And I discovered my tumor myself, and I went to a breast surgeon, and he actually thought it was probably nothing, but just to be safe, have a mammogram. So that mammogram led to the diagnosis of a tumor, 4.5 centimeters, quite large. And after a biopsy, when I could see just from looking at the radiologist in her eyes that this did not look good, this needle biopsy, I got the news, breast cancer. Eventually, because the tumor was so large, I had chemo first, and then double mastectomy, and then radiation, and then removal of ovaries, and then was on aromatase inhibitor for 10 years. So that was my life interrupted for actually, at least an entire year in terms of the process. And, many years later, it's still with you every day. There's no way around it. Every time you have a little this or that, or even with COVID, you start wondering, are you more susceptible? So it's part of one's life. I must also add that this was not my first cancer experience. I had appendix cancer back in 1999, which is very rare and very unusual. So having cancer twice in my life, the whole concept of precision medicine is so important to me and to my family. My father had prostate cancer and lymphoma. My daughter had thyroid cancer. My first cousins, 2 of them had breast cancer, and aunt had breast cancer. So there is a lot of cancer in my family. And I worry, of course, for my other children. When I was diagnosed with appendix cancer, my eldest daughter was going off to college. When I was diagnosed with breast cancer, our third child, our son, was going off to college. I don't think there was any correlation there, but it was a real hard time, and for all of us, particularly, my kids. I had a lot of family support. I was very lucky. A very supportive husband and children. And, but it's a long process. I have been an advocate my entire life. And so once I had breast cancer, I continued to have our association apply for Susan Komen grants. And we had those for about 10 years, reaching out to women with disabilities at a national level and also in the DC area and surrounding counties, with the goal of trying to make women aware of risk factors, and that basically your biggest risk factor is that you're a woman, besides, the piece about the BRCA gene and whatnot. But if you're a woman, you are at risk for breast cancer. And it was very important for us to get this message to the disability community. We kind of adopted a slogan, lightning can't strike twice. And we worked a lot around the community with women with disabilities and healthcare providers, and tried to develop a whole host of materials on accessible mammography facilities, guidance, things of that sort. All of this is on our website, and if I can figure out how, I can put it in the chat room. Otherwise, I can get it to Paula and Brittany. So I guess, my goal is I don't want anybody to have to go through what I've gone through twice, actually. So there are 2 years of life interrupted that have been in my life, chemo both times. And precision medicine just seems to be the road to try and understand disease prevention and treatment, and just be a better way for all of us to live and to survive with treatment, because treatment is part of the cancer world. But the degree of the treatment and the focus of the treatment and the targeted therapies have really come a really long way. So that is my story. I'm looking at my notes because, as I said, at some level, it's 2008, and cancer becomes part of you. It doesn't define you, but the memories started actually to come back watching the film and hearing Paula. So thank you, and I look forward to a lively discussion and questions. And Paula, I turn it over back to you.
Thank you, Roberta. Thank you for sharing all those meaningful details. So our next panelist is disability policy consultant, June Kailes. June is a pioneer, leader, and innovator in the healthcare world. June has over 4 decades of healthcare experience and works internationally, as well as with local, state, federal governments, and community-based organizations. Her breadth and depth of knowledge in access and functional needs, and her work as a writer, trainer, researcher, policy analyst, advocate, and subject matter expert is widely known and respected. She has the unique ability to blend and bridge 2 worlds: disability lived experiences and healthcare. June works with a variety of health facilities, plans, clinics, medical centers, systems, government projects, and other consulting firms. June's disability competency workshops cover the demographics of disability populations, compliance with the function versus diagnosis, employment rates, and health disparities, compliance with the Americans and Disabilities Act, attitudinal communication, physical, medical equipment, and programmatic access, care coordination, long-term support services, and stakeholder engagement. June, would you like to tell us a bit about yourself and your lived experience with breast cancer?
Sure thing. Thanks, Paula. And boy, listening to Roberta, I'm reminded of something I always say to people, which is, I'm fine now until otherwise notified. Because we all live with kind of an underlying fear that we always keep in check after we've gone through the experience. So my experience was gone through as a woman with a disability. I have cerebral palsy, should affect my balance, my coordination. I'm a scooter user, mobility scooter user. And so it's a experience that not, women have that had breast cancer, but there's another whole layer of peeling the onion of the barriers. So I was diagnosed in 2002. I noticed the dimpling that took months to really get the attention I needed, to get an ultrasound, because nothing ever showed up on a mammogram. Finally, I had a biopsy and then a lumpectomy and then the whole bucket of one we called back then the splash, poison, and burn treatment. The surgery, chemo, radiation. I went through the BRCA testing. It was negative. I had a surgeon who I said, I read up on this, when I don't know something, I dive in and get a quick degree in what I don't know. I read Susan Love's breast book and a lot of other things. And so I said to the surgeon, I said, I walk with my hands, so do not screw up my arms. Because I'd read a lot about lymphedema. She looked at me like, uh-huh. So my gynecologist happened to be in the surgery that day, and she said to me later, I never saw the surgeon be more careful than she was with you. But subsequently, she could only find one lymph node, and it was positive. So they wanted to go back for more. I said, I need to think about that. She said, what do you mean? I said, well, I'm not sure I want to do that. And so, again, I did a lot of research and decided, nope, it's not something that people say is, really important. And there's a lot of disagreement. So my answer is no, we're not going to do that. As Paula said, I always worked in healthcare. So I had a colleague that said to me, June, this is just a chance for you to practice what you always preach in terms of being a savvy healthcare consumer. And that was certainly something I really had to do. In terms of seeking support from other women, I did seek support from women without disabilities. And there were some issues for me personally, because the women I talked to, I got their story that this was really the end of the world. And for me, having been born with a disability and all that means as an advocate and survival skills, this was just one more fight. This was not really the end of the world, but one more thing that was going to test my assertiveness and my creativity and my insisting on being listened to. So that I was often running with experience. And I did find women with disabilities that were very helpful to me, that were going through it at the same time or had already gone through it. And one thing that we shared was, our issues around body image were different. Some of us long ago had kind of discarded some of what we call back then the Madison Avenue values of what we were supposed to look like, smell like, weigh, whatever. And so that was kind of off the table and not something that we were particularly concerned about. So it was very helpful getting reinforcement from them in terms of the way we had to insist that people problem solve with us and be a partner with us and seek providers that were not going to direct the show, but were going to do it with us and not just for us, or to us. So that kind of reinforcement, peer support, was really very, very helpful. My oncologist, you know, said to me, you know, I thought I was really going to have to treat you with kid gloves because you had special needs until you opened your mouth. And then we were really off and running. And the surgeon too, she wanted me to sign something back then. You had to sign something that said you would agree to arbitration if something went wrong. And I said, well, I don't, you know, so she called me into the office and she said, you didn't sign this paper. I said, I didn't sign it because I didn't understand it. And she said, well, I can't see you. I can't treat you unless you sign it. So I said to her, you know, I'll sign it, but I have a month to revoke it. And she said, how do you know that? I said, I read that part. So we were off and running in terms of a kind of a dynamic tension, which in the end, I think she enjoyed it. You know, when it was all said and done and over, she said, you know, I'd like to see you again about 3 months. And I said, why? And she said, because I like you. I said, okay, well, let's have lunch. You know, let's do something social. Let's not, you know, I don't need to come into the office. So I really did it to practice a lot of my advocacy skills and battling with the surgeon. And it took a lot of work on my part. And, you know, you have to kind of have the wherewithal within you to do some of this. After all was said and done, and I was back to my regular working self, I went for a mammogram, and the technologist was different person, and I think, oh, here we go. So she said, I said to the technologist, I said, you know, we're gonna need 2 people. And she said, oh, honey, I've been doing this for years. Let's do it my way. I know what to do. So I said to her, oh, honey, I've been doing this for years too. And I know what works for me. And we better do it my way.
Good for you.
And she kind of screwed up her face and then took a sigh and said, so she did it my way. And afterwards, she said, you know, you were right. I said, yes, you know, sometimes it pays to really listen to the experience of people who have atypical bodies and can't really stay as still as you need them to be when you're, because I went through years of having blurry films, blurry pictures that were not readable. And so I really have enough confidence within you to kind of dictate some of this self and stand up for yourself. And the other thing I remember was during radiation, you know, you had to keep your arm up like that, and I couldn't do that. I, you know, stay still, you know. And so I said, well, we don't know what to do. I said, well, tie it up, do something, you know, stabilize it. And they go, oh, well, you know, they weren't too good at that, but they found masking tape at the time, not too sophisticated. So that's how they kind of problem solve some of that. And there was a lot of this that went on where I had to kind of come up with, let's do it this way. Let's try this. What about this? So it's all about being assertive and not being shy and treating it very much like a partnership. You know, we're in this together. You know, disability is diverse. Evidence-based only goes so far when you're dealing with atypical kind of things. So more later. Paul, back to you.
Okay, June, thank you so much. The things that you mentioned about being being an empowered patient and an advocate for yourself are so important to all breast cancer survivors. And we really appreciate, hearing some of your stories. So finally, but certainly not least, I am pleased to introduce Wanda Lucas, founding member of the Georgetown Breast Cancer Advocates, and currently serving as the Vice President on the Board of Directors for the National Breast Cancer Coalition. She is a graduate of the Project Lead Institute and has served as a consumer reviewer for the Department of Defense Breast Cancer Research Program. In 2011, she was recognized by the she was recognized by the White House as a champion of change and was honored for her grassroots advocacy by NBCC in 2014. She was diagnosed with breast cancer in 2006. She received her BS degree from the University of Illinois and her MBA from American University, where she now teaches. Wanda, why don't you tell us a little bit about yourself and your lived experience with breast cancer?
Well, thank you so much, Paula. So I would say that my experience with breast cancer probably started out like a lot of people. You get the shock. My tumor was discovered through a mammogram because it was non-palpable. I was diagnosed with stage 2A, ER positive, PR positive breast cancer. And I so appreciate June's story because I was just like her. I understood science very well. I was a pre-med major until I got to organic chemistry. So I learned a lot about breast cancer and really challenged my healthcare team a great deal. So I had a lumpectomy, I did radiation, but I also refused chemotherapy based on my own personal research and decided to just do the hormonal therapy. I took an aromatase inhibitor like Roberta did. But I also became very concerned with how I observed people of color being treated in, oncology departments and hospitals by their healthcare team. And I felt the need to be that voice for the voiceless. So I participated in studies. I actually agreed to participate in a very important clinical trial. I didn't know it was so important at the time. And while I was going through it, it was very difficult because it was very harsh on my body. But when I wanted to quit, I kept telling myself that this was not about me, that this clinical trial was going to, inform other research and hopefully help other people. But through one of my studies, I met a researcher at Georgetown University who really changed my life in terms of creating this advocate that you see today, because that was not what I had planned. So I'm a big proponent of precision medicine. I think patients, anyone that's facing a cancer diagnosis needs to have that voice, needs to be okay with challenging a healthcare team or asking those questions. I asked a lot of questions and I got very angry at the answers. And I would say, don't tell another patient that answer. Like, that is not the way you deliver that answer. So Roberta knows me well. She's not surprised that I say that. But so I see persons of color very much, their experience is very much in line with persons with disabilities in the way some healthcare teams or practitioners view us. They make assumptions about us, whether we're going to understand something, whether we're going to adhere to something, and I know with the All of Us initiative, which I applaud, what I wonder is, are they uncovering the poor communication between health providers and patients? And the recognition that so many people are simply not asked to participate in research, So as I said, my experience with breast cancer definitely, was not one that I planned, but, I currently lobby on Capitol Hill, and that's big for somebody who was not political. I'm very political now, for research funding, but funding for research that matters, that makes a difference, you know, so, and I'll leave it at that so we can carry on with some more questions. But thank you, Paula.
Thank you, Wanda. You know, your passion is so moving to me, and it reminds me of so many of the survivors I've met who what they want to do is help the next generation of survivors and make things smoother and make things clear for them. So, you know, your generosity and passion are really appreciated. We are hoping to get some questions from the audience. I'm going to read a couple of comments, and then we'll go on with questions that we have here, but we're happy to answer anybody's question that is still listening to the chat. Barbara Comlow from YouTube says, "Hi, Roberta. Hi, Wanda. Hi, June." Does that land? That was an amazing film, and thank you for having this panel. That's Daniela Capobianco. Great film, Kamika Allen. Thank you very much for that. So I guess we will, I see these are some other questions. So I'm gonna actually go back to Roberta. Wanda spoke about clinical trials and how they got her fired up in hopes for things being better for the future generations. And can you maybe just briefly and clearly explain what is the All of Us research program, and how could participating in a research program like All of Us improve health outcomes for people diagnosed with breast cancer? And I would also add in underserved communities if you want to discuss that.
Sure thing, Paula, and I'm mindful of the time here, and I know that we have a whole list of questions, so let me just kind of be brief. First of all, the focus of All of Us is on underrepresented and underserved populations, so I think that's a really important piece. AAHD is involved because we focus on people with disabilities. And there are numerous partners at various levels as part of the All of Us program that focus on underserved and underrepresented populations. And, you know, NIH or precision medicine is really the key behind the All of Us program. It's sponsored by NIH. It's a biomedical research program. The goal, the purpose is really to accelerate research to improve health by building a million person plus research database, which will really help researchers understand how to prevent and how to treat disease. And the goal is to solicit more than 1 million people. And there, at this point, I don't know the exact numbers, but I think there are over 300,000 at this point. And the goal is the researchers will then use all this data to learn how our biology, how our lifestyle, how our genetics, how our environment really affects our health. And that's so true of breast cancer. I mean, I was listening to Wanda and June, who I've known for a long time, and I learned more about each of them and their breast cancer history. And it's very different. Wanda's wasn't palpable and showed up on a mammogram. So she had a mammogram. You know, I had just had a mammogram and had a huge tumor, which led to stage 3 breast cancer. You know, June had a little dimple and so, which led to say stage 2A, I think you said, breast cancer. So back then, I mean, because we were before the oncogene test, which is just really progress in terms of, you know, targeted therapies, we all got, well, Wanda didn't, she opted out, not for chemo, but, you know, June and I got, you know, heavy duty chemo and radiation. And we take these, you know, aromatase inhibitors, and nobody really, it's evidence-based. You know, we get that, but there's so much more we need to learn. And All of Us is really the first research initiative focusing on biomedical research that will give us some of these answers so we properly treat and we understand, why does someone like myself get 2 types of cancers? And aggressive cancers. And there's just, it's an amazing program. And, I sound like I'm a poster child for it, but I truly believe in it. And you can go to the website.
And the link's in the chat.
It's that, yeah, and sign up. I mean, it's just amazing. And the researchers, the database or the workbench is a research hub, which hosts a workbench, will have access for researchers and access for the public. So there's a tremendous amount of information. Healthcare providers can enter through electronic medical records, all the biospecimens that people provide to the program. So I would really encourage people to check it out and sign up immediately, because this is the only way we're really going to know. How can we treat? How can we prevent?
That's absolutely right. I've signed up, and I think, people are always asking, what can I do? And this is something that you can do, and it's very simple on your end. So do check the link in the chat. So I want to put a question out to all three of you. And again, you can be kind of brief and anecdotal in your answer. But tell us about something or someone or an incident that was helpful to you when you were either experiencing breast cancer or when you were advocating for someone else, since it's been a little while for some of you. But just, some basic things that you found super helpful. Anybody want to grab that one?
Yeah, I'll grab it.
All right.
I was reflecting on as we prepared for this. There is a website that I worked on. It was sponsored by the Center for Disease Control. It's called the Right to Know campaign. And if you search for it, it comes right up, the Right to Know campaign. And there you'll find a number of women who talk about their breast cancer experience with disabilities and really kind of address the implicit biases that Wanda and I talked about, whether we're Black, just the brown, multiply marginalized people. I mean, there's a lot of good stories on that website. And I think that really spoke to me. I have a researcher friend who wrote all about women with disabilities and going through treatment. And she's a doctor, and she could not get the article and the research published. People thought, oh, nobody'd be interested in the experience of women with disabilities. And just an example, I had one friend who, nobody told her about when you have the ACT, remember the Red Devil, adriamycin, cytoxan, and taxotere, which became Taxol. The adriamycin, for somebody who uses a urinary catheter, that's like poison in your urethra. And nobody warned her about what that's going to be like, and that there needed to be preventative measures. At the time, nobody had a high-low exam table. They would just look at us and say, hop up. And I'd say, good luck with that, get an exam table, this height adjustable, so we don't have to take our lives in our hands by this so-called hop up direction. So just quickly, two things that, and more that are on that website that I think will help.
Does anyone else want to jump in on that?
So really quickly, I would say what helped me was my faith.
Like Debbie.
Yes, exactly like Debbie. My faith helped me, my prayer life, my praying partners. And I found that I only told a select group of people when I was diagnosed, people that I knew that would pray for me and wouldn't want to talk about it all the time, but just reminded me of, God's power for healing. So that really helped me a great deal. And after everything was over, when others found out about it, some got very angry that I hadn't shared it. And I basically said, well, that's something you're going to have to get over. I had to do something for me. The other thing that I did, and I don't know where it came from, when I received the diagnosis, I called my insurance company. I don't know why. And I told them, and they told me to get a piece of paper and write down everything they were telling me, what they would cover. They encouraged a second opinion, you know, there's all these things. And I felt that that information was like a backpack. It equipped me with information to take to all my appointments. And then they did something so remarkable. Like 3 months later, they called me, and I thought they were going to kick me out of their insurance program. They were calling to check to make sure I was okay, that I was satisfied with my health. And people just don't believe it. I mean, it was unreal. They wanted to
Hard to
remind
believe.
me of mental health counseling,
That's
and
amazing.
they wanted to know if I was satisfied with my providers. They had all the information. So those are two things that really helped me. So,
Hey, Wanda, I have to add to what you said. I had a friend who said, June, you better wear a wig when you're working because you don't want people just forming prayer circles around you.
Yeah, that was sort of one of the questions I'm curious to ask each of you, and then we're going to have to wrap up. Somebody said, do people work during cancer and cancer treatments? I can certainly say I did. Do each of you want to just mention what it was like and what you did?
Yeah, for me, I travel all the time. So I had to cancel like 12 or 13 trips immediately.
Mm-hmm.
But I worked through the whole thing, and that basically saved my butt.
Yeah.
You know, that meant I had an external focus. I could go into the work zone and not have to think about this 24/7, only the 8 hours at night. Okay.
Yeah, I would echo that, June. I always say work is therapy.
Mhm.
And, you know, family members and friends, they'd say, well, why are you working? You should take care of yourself. And I'm saying, I am taking care of myself. Work was therapy. It just, as you know, I said earlier, cancer doesn't define you.
Right.
It just becomes part of who you are, and going through treatment. Not to say there weren't some really tough times, as you know, June said, with the ACT or TAC, I forget exactly. I mean, that was pretty tough. And so, you know, there were days that, yeah, you know, they were down days, but for the most part, you got to keep going. Wearing the wig, that was another story. That was, mine turned out to be, I didn't used to be gray, obviously. I had brownish, blondish hair, and my wig turned out a little more blonde. And so I was a little self-conscious, like, this, what does she look like now? But besides that, I, if able, you have to take care of yourself physically and mentally, but if able, and work is therapy, or whatever it is that one does. If it's not a job, if it's whatever was their identity prior to their diagnosis, they need to keep that going.
Yeah.
But Wanda, I know we're running
I was
late.
gonna say, I worked as well, and I agree with Roberta. I think it's important for a lot of people facing a cancer diagnosis to have some sort of normalcy,
Mm-hmm.
you know, so you have to do what's right for you. So
Yeah.
I worked as well. Yeah.
Yeah, I mean, I think all of us have just gone through COVID and this idea about normalcy, you know, how we created that in our home environments or whatever to help us get through was important. I just wanted to add one thing. For me, I think one of the hardest things was knowing I was going to go through the bilateral mastectomy. And so I was shooting, you know, there's shots of me in the hospital, and I actually found that useful because I was so scared the night before, and I was just like, okay, I have to focus on getting release forms and, you know, getting the right lighting and getting the shots that I want. And so I was able to, you know, redirect my anxiety to that, and you know, and that was helpful. So I think that what all of you said really resonate for me too. So we're going to be wrapping this up, and I just want to thank all three of you, Roberta, Wanda, and June, for this engaging conversation and for the amazing work that you do. It's so important, and you know that I know it's fueled by your passion, so I just want to thank you. And we're going to turn this over back to Brittany.
Paula, Thank you so much for moderating this event. June, Roberta, and Wanda, thank you for joining us today. To all of our live audience members, we want to thank you for attending our Life Interrupted watch party and panel discussion. This program was made possible in partnership with the American Association on Health and Disability, the National Library of Medicine, the Network of the National Library of Medicine, and the National Institutes of Health All of Us Research Program. Before you go, we welcome your feedback. A link is available in the chat. Your responses will help us continually improve our programming. Thank you and good evening.